Good afternoon, everyone. This is the Vermont House Committee on Commerce and Economic Development. It is Wednesday, February 25th, 2026 at 1:02 in the afternoon. So we're beginning our afternoon to take a look at H-160, which is an act relating to creating a right to repair for medical devices. We have Rick Sagal with us, our legislative counsel. I think we looked at this last year. We didn't.
Maybe a walkthrough.
We did a walkthrough, but I think it was briefly long enough ago that we probably need a refresher.
Yeah. All right, good afternoon, Rick Sagal, Office of Legislative Counsel. So H-160, the chair said, is a right to repair bill. And just kind of as share my screen here momentarily, there's been several of these bills the last several years, right to repair. There's been a general, I think it's 161, right to repair bill. There's been a right to repair agriculture equipment that almost got its way to the governor's desk a couple years ago. So there's this idea that consumers don't always have the ability to repair equipment, or the maybe some of the places that do repairs that are not the manufacturer, places that offer repairs of equipment sometimes can't do the repairs. There's some technical things that I think are preventing people from conducting the repairs. So you must send it to the manufacturer or someone that the manufacturer authorized to repair the equipment. So this bill, 160, is specific to medical devices. It does create a new chapter, which is in Title IX, and would have more of these right to repair in case the General Assembly ever decided to add several different rights to repair. So we start off with definitions as usual, and the definition of authorized repair provider is some type of entity that has this arrangement with the original equipment manufacturer, where this OEM, I'm going to say that for short from now on, where the OEM grants to this individual or business a license to use their trademark, service mark, or some other identifier for the purpose of offering the services of diagnosis, maintenance, or repair of medical equipment under the name of the OEM, or some other arrangement with the OEM to offer such services. So again, this is like a license or some kind of agreement that the OEM has with a entity to do these repairs. An OEM, same definition, that offers the services of diagnosis, maintenance, repair shall be considered an authorized repair provider. So if company X not only sells the product, makes it, but also repairs it, company X would be considered an authorized repair provider. Documentation means any manual, diagram, reporting output, service code description, schematic diagram, security code, password, or other guidance or information used to perform the services of diagnosis, maintenance, or repair of medical equipment. Fair and reasonable terms means making available parts, tools, for documentation with respect to documentation for repair, that the documentation is provided by the OEM at no charge, except that when the documentation was requested in physical printed form, a charge may be included for the reasonable actual cost of repairing and sending a copy. With respect to tools, the tools that are made available by the OEM at no charge and without requiring authorization or internet access for use or operation of the tool, or imposing impediments or to access or use of the tool, to diagnose, maintain, or repair and enable full functionality of medical equipment, except when it's in physical form, a charge may be included for the reasonable costs. With respect to parts that are made available by the OEM, either directly or indirectly through an authorized repair provider, to independent repair providers, which is defined later, and healthcare facilities at reasonable costs and terms that are equivalent to the most favorable costs and terms under which an OEM offers the part to the authorized repair provider, and that any account for any discount, rebate, convenient, and timely means of delivery, means of enabling fully restored and updated functionality, rights of use, or other incentive or preference that the OEM offers to an authorized repair provider, or any additional cost, burden, or impediment the OEM imposes on an independent repair provider or healthcare facility. that are not conditioned on or imposing a substantial obligation or restriction that is not reasonably necessary for enabling the independent repair provider or healthcare facility to engage in the diagnosis, maintenance, or repair of medical equipment made by or on behalf of the OEM and are not conditioned on an arrangement described in 1A, which is the authorized repair provider provision. Okay, healthcare facility means all persons or institutions, including mobile facilities, whether public or private, that proprietary, not-for-profit, that offer diagnosis, treatment, inpatient, or ambulatory care to two or more unrelated persons and the buildings in which those services are offered. The term shall not apply to any facility operated by religious groups relying solely on spiritual means to repair or healing, but includes all institutions, including 18 VSA 9432A, 8, except health maintenance organizations. Independent repair provider means a person operating in the state who does not have an arrangement as an authorized repair provider and who is engaged in the diagnosis, service, maintenance, or repair of medical equipment. Medical equipment or just equipment means any power device approved by the US FDA that is used in the treatment, monitoring, or diagnosis of a patient and includes assistive, adaptive, and rehabilitative devices. Original equipment manufacturer or OEM means a business engaged in the selling, leasing, or otherwise supplying new medical equipment manufactured by or on behalf of itself. Part means any replacement part, either used or new, made available by the OEM for purposes of effecting the services or of maintenance or repair of medical equipment manufactured by or on behalf of, sold, or otherwise supplied by the OEM. Tools means any software program, service key, hardware implement, or other apparatus used for diagnosis, maintenance, or repair of medical equipment, including bless you, including software, other mechanisms that provision, program, or pair a new part, facilitate access to the equipment's repair and diagnostic functions, calibrate functionality, or perform any other function required to bring the product back to fully functional condition, including any updates. And trade secret has the same meaning as in federal law. Any questions about the definitions? Okay. So the requirements for medical equipment and parts sold and used in the state. So right there, we're talking about not just products that are sold here, also used. So you can buy a product in New York and bring it here. That would be considered you using the medical equipment in the state or a part. The OEM of the equipment or parts or an authorized repair provider, the OEM of the equipment or parts or an authorized repair provider shall make available to independent repair providers and healthcare facilities on fair and reasonable terms documentation, parts, and tools that are required for diagnosis, maintenance, or repair of the medical equipment and parts for the medical equipment, inclusive of any updates to information, and training courses and materials on the operation, inspection, diagnosis, maintenance, and repair of the equipment that the OEM similarly provides to authorized repair providers. Some of these equipment parts have locks, security locks. So for medical equipment sold and used in the state that contains an electronic security lock or other security related function, the OEM of the equipment or parts of an authorized repair provider shall make available to independent repair providers and healthcare facilities on fair and reasonable terms, special documentation, tools, and parts required to access and reset the lock or function when disabled in the course of diagnosis, maintenance, or repair of the equipment, and they shall be made available through appropriate secure release systems. Okay, limitations. This subchapter does not require an OEM to divulge a trade secret to an independent repair provider or healthcare facility. It does not alter the terms of any arrangement described in 4049-1A, which is the authorized repair provider provision, including the performance or provision of warranty or recall repair work by an authorized repair provider on behalf of an OEM pursuant to such arrangement, except that any provision governing such an arrangement that purports to waive, avoid, restrict, or limit the OEM's obligations to comply with the subchapter is void and unenforceable. OEMs and authorized repair providers are not liable for damage caused to any medical equipment by independent repair providers or healthcare facilities that occurs during the course of the repair, diagnosis, or maintenance of the equipment. This language looks familiar, enforcement language, so this would be under the Vermont Consumer Protection Act, which makes it clear that a violation of this subchapter is a deceptive act in trade or commerce, and the AG would have the same authority to make rules, conduct civil investigations. This is the same language in most of your consumer protection bills. Implementation. This act applies to medical equipment and parts sold or in use in the state on or after the effective date of the act. So just to make clear that if a product is in use before the act and the repair happens, or the need to repair it happens before the act is effective, then that would not be required of the OEM to provide those tools or equipment. However, if it's used after the effective date, then you could request the repair be facilitated. And of course, if you buy it after it's effective. And the effective date would need to be changed. This was a bill from last year. So currently it's set for July 1, 2025.
So implementation, if it's sold before July 1. It's been covered, but if it's in use after July 1, it is.
This covers individual people making sure.
Let's look at the definition.
Yes, please. Thank you.
So it includes independent repair provider, which means a person operating in the state who does not have an arrangement with an OEM and who is engaged in the diagnosis, service, maintenance, or repair of medical equipment. So if it's just somebody, a individual who, as a hobby, does this type of work, I don't think they would meet that definition. I think it needs to be someone that is their business, that they engage in this type of work. If you wanted it to include individuals, I would update the definition to do that. But this equipment might be more complex. I don't know if that's going to be an issue either.
I think under most circumstances, I like Jonathan's idea, but I think here, I'm on, because you could be dealing with people's lives here. And you don't want some guy rolling up and says, I think I can fix this, going in there and now someone's dead. So I think that because we're dealing with medical equipment, there needs to be a higher bar.
On that, I'm wondering if they're about the actual patient themselves. If they are somebody that is able to and has lived with this equipment and understands like how to make it work, do we want to make some space for them?
Dialysis machines that are around the home, but they should have this equipment.
Yeah.
But maybe that is a good reason too.
Rick. Okay. Thank you, Rick.
I'm gonna watch my office if you don't mind. Be deal with questions.
Good morning. Devin Green, Vermont Association of Hospitals and Health Systems. Thank you for having me in today. And we are very supportive of H-160, the right to repair bill. As you all know, Vermont is at an inflection point in healthcare affordability right now, and we are looking to make things more affordable for Vermonters, as well as ensure that they get steady access to care. And so we welcome the option to allow for servicers to repair without restrictions. I will say that the FDA has guidelines around this. CMS, the Centers for Medicare and Medicaid, have their conditions of participation that address this. The outcome of violating those conditions of participation is that you don't get Medicare or Medicaid funding. So we take those very seriously. I think they provide a good guideline. And in short, we are really just looking for more flexibility, ways to reduce expenses, as well as ensure that our patients receive uninterrupted care. So we support this bill.
Questions for Devin? Or-
Yeah, so are there any differences, one way or another, from the federal guidelines to what's in this bill?
I think I will have to go back and look at them further, but I think my understanding is that this is a little bit different. This talks about the federal FDA guidelines talk about what remanufacturing looks like and how to do that safely. And then, so I think it's a little bit different. It's talking about the safety sort of standards around all of this as opposed to allowing people to do the repairs.
Devin? Thanks, Devin.
Thank you. And I have to run to another committee, but thank you.
Adrian?
Thank you for this opportunity to testify. Chair Marcotte, Vice Chair Granning, Ranking Member White, and members of the committee, thank you for this opportunity to testify in respectful opposition of H 160. My name is Adrienne Frederick, and I am testifying on behalf of AdvaMed. We are the largest medical technology manufacturing association, and we have on our nearly 600, our nearly 600 members include innovators and manufacturers across the full spectrum of medical technology, from diagnostic and imaging tools to digital health and life-sustaining devices. Patient safety is AdvaMed's top priority, and H 160 would unnecessarily expose patients to an increased risk of harm by requiring medical technology providers to share proprietary design and repair information with unauthorized third-party servicers. I will note, of the 8 states that have passed right to repair laws, none of these laws have applied to FDA-regulated medical devices. Further, Vermont's other pending right to repair bill, H 161, exempts medical devices. Medical devices are often complex systems, and often unauthorized service providers lack the necessary training to repair these systems. For example, if imaging equipment like a CT or an MRI isn't calibrated correctly after servicing or repair, it could lead to detrimental patient outcomes. I was not intending on sharing this story, but this is a personal story for me. I have a cyst on my heart. I require imaging regularly to make sure that cyst does not get any larger. A lot of it depends on the size. If it grows, then I have to have intervention. If it doesn't, I continue to be monitored. I rely on the accuracy of these devices. And so patients and providers depend on the diagnostic information to be accurate and for the devices to be used functioning as expected. Medical device manufacturers are subject to strict regulations by the Food and Drug Administration to ensure patient safety. These regulations protect the safety and efficacy of medical devices and include registration with the FDA, implementation of quality and safety controls, proper training, and qualification of replacement parts. Medical device manufacturers are required to follow FDA regulations and are required to report adverse events. Unauthorized third-party servicers are not required to do either. If a device is improperly repaired, it could lead to a significant liability risk. In fact, an FDA report found that more than 4,300 adverse events, including 294 serious injuries and 40 deaths from devices repaired by unauthorized third-party servicers. Proponents may suggest that this bill will alleviate delays, but there is no evidence of systemic shortages or delays. With appropriate training, device manufacturers regularly authorize third-party services to service and repair medical devices. In closing, I would like to reiterate that patient safety is our #1 concern, and every single state that has passed a right to repair law has recognized this concern. and provided for patient safety. Again, thank you for your consideration, and thank you for the opportunity to testify today. I'm happy to take questions.
Questions?
Oh, yeah, thank you. I was just wondering if you could just point us as we're researching this as a committee, like to sources for the harm that you started out with your testimony with, as far as studies and stuff goes.
Is it okay if I reach out to you after the fact?
Sure, absolutely, totally.
I'm sorry, your name?
Oh, you can just send it to the.
I'll send it to Jonathan. Okay, thank you so much.
I was just wondering, you say that you work with third-party companies.
Yes.
To authorize, is there a charge for them to get authorized? And what kind of, do you have like agreements? How does that all, how easy is it for someone to get authorized, I guess, is what I want.
I'm sorry.
I'm sorry.
That I would have to ask some of our member companies. I unfortunately, those are contracting issues, and I cannot broadly speak to the contracting issues, but I do know that they train folks, especially in areas that there's may not be a large population. The difference between being in Boston and being up here. So there may be third-party servicers, authorized third-party servicers working in this area or further north in New Hampshire, things like that.
Thanks very much. So I was curious, I think previous witness talked about FDA and Medicare participation rate, participation
Yes.
agreements, and they seem like safety standards. And so I'm curious where you think the hole is there, gap is there.
So as part of the life cycle of a device, once it's authorized by the FDA, our member companies, the manufacturers have to report adverse events. In my understanding, the CMS regulations you don't have to report adverse events under that. I could be wrong about that and I can double check. But there we're talking, Devin was speaking mostly to the remanufacturing of things. And that is a different portion. That's taking something that's being, for example, if somebody is putting in new equipment that an OEM can take it back and they can remanufacture it and then resell it, refurbish it. And that is a separate part that FDA also does. But I'm speaking to the life cycle of the product, in which as the product is being used by patients, that if there are adverse events that they would have to report, original manufacturers would have to report any adverse events that they would know of.
So you're saying that the federal regulations only apply to the manufacturer of the device itself?
So there's the FDA requirements for the device as part of, it's called the 510(k) process. That is different than the remanufacturing. I unfortunately am not an FDA expert and I would have to get more information about it, but that's, yeah. There are people who are far smarter than me who do the FDA work. But I'm happy to follow up with, I can follow up with some more additional information about the
And
manufacturing.
Medicaid participation agreements.
Yes.
Really?
So I was really curious about I guess I'm sort of similar to what Tony was talking about. I'm curious to know if there is a timeliness or any kind of delays getting repairs for like very rural environments. And I'm also thinking specifically not just of the hospitals and institutions, but for patients, if they have medical devices that they're using at home.
Yeah, if you have like at-home dialysis and things like that. I can double check on that. I don't want to misquote it. I know we have some statistics around most X percent is within this period of time, this percent that. Sometimes, and I know it came up during the pandemic, that there were issues and delays. A lot of that was linked to global supply chain issues. Those supply chain issues have largely resolved themselves. So
Great.
assuming that there's not any other, outside forces acting on supply chain issues.
Thank you.
Yeah, so I was going to ask a very similar question to Emily. So yeah, I would also be interested in the statistics around, like when we were dealing with the general right to repair, we were looking at, farmers having their tractors break down in the middle of fields and then waiting on going through very specific entities that control the marketplace rather than being able to go to local. And like to extend that point and build off of it, could you speak to the fact of often when we're seeing this, there's very few players who control the entire marketplace. And I think as a consumer protection and also looking at business innovation and things like that as a committee. We're trying to like balance that. And so could you speak a little bit to like your thoughts as far as like in support of the right to repair is that this creates a competitive marketplace and it expands access to resources. But I'm assuming you have counterpoints to that I would love to hear.
Is that if somebody is interested in becoming an authorized third-party servicer, they would just need to reach out to the original the OEM. There is nothing prohibiting somebody who is interested in becoming one to take the necessary steps to do the trainings, to connect with those manufacturers.
Do they have to pay to do that as well?
That, I believe, depends on it. That would vary by OEM to OEM. I unfortunately do not know the specifics of certain contracts, and that would speak to sometimes of the business decisions. But there's nothing prohibiting that. There's also, I'm sorry, I had another thought and I don't remember what it was.
Do you have statistics on the general, even if it's an average cost of somebody being able to be licensed? That would be an interesting thing for us to learn, I think.
Why don't you finish taking? This pertained to the element of the testimony that was submitted to our committee about that 2018 reports.
Yes,
Is the assertion that the cause of the injuries and deaths was specifically the third-party main repairer, or just that it's
I believe it was tied to unauthorized third-party repair.
so it's a causal link?
Yes, I believe that's what the FDA report stated. And that is the incidents that we know about.
Yeah.
Because I've heard anecdotally from people like one of our members has a technician out in rural western Montana, Idaho, that kind of area. And they had an AED. He was servicing another piece of equipment, and this technician asked, do I need to service the AED while I'm out here? And they said, oh, no, the radio guy will take care of it. The next time he was out there was to repair that AED because it malfunctioned and a patient had passed away. I don't know if that was reported as part of the adverse events, but a lot of times when we hear about it, it's anecdotal from somebody who had to go out and fix a piece of equipment. So.
A follow-up question
Yes.
is repair of devices could you estimate about what portion of an OEM's revenue is tied to maintenance?
I unfortunately have no, that's beyond my scope of information, but if you're curious about it, I can see if I can find some.
Thanks, that'd be wonderful.
I'm just waiting for you to finish.
I appreciate all the questions. I'm sorry, I'm a slow writer.
No, you're all good. You're all good. I would just, so I know that the US Army has come out publicly saying that they would love to see medical right to repair pass. And so I'm curious, especially thinking about our National Guard and things like that. Would you support the US military having access to right to repair when it comes to medical devices in the field, basically?
So I unfortunately cannot speak to that. I do know that when there's devices that are deployed into like forward operating bases, those are often meant to be left behind or they can be replaced. So if you're going into, like, say you're going to a forward operating base, you will go, if you need like an ultrasound, it could be a tablet and it could be an ultrasound wand. That ultrasound wand, I'm using this as an example only as a hypothetical. That could just be tossed if needed, and they could send a new one out. So unfortunately, I cannot.
That's okay.
I'm not in a position
All
to
good.
make a statement regarding
Yeah.
what the military would be.
Yeah, no worries.
The questions? Thank you.
Thank you.
Okay. Good afternoon.
I finally found the buttons. Hello, everybody. I'm Gay Gordon Byrne. I'm the Executive Director of the Digital Right to Repair Coalition, otherwise known as repair.org. I'm so happy that you've allowed me to speak with you. I'm sorry I'm not in Burlington with you. I'm going to plead snow. we've had quite a lot of it, and it is in the way. Anyway, I just wanted to give you guys a little bit of a briefing of what's going on around the nation. There was a couple comments made about none of the other states have included right to repair, which I find pretty funny because we've included right to repair in all of our bills since 2014. It is the legislators that choose how they're going to slice and dice the opposition. And sometimes they want to focus on ag equipment, and sometimes they want to focus on appliances. We don't get to tell them what they want to do. And if they decide they want to trim the bill down and make it more interesting for their constituents, they will trim what they want to trim. And unfortunately, medical equipment is easy to trim because people don't understand it. They'll hear things, and I've heard this in actual testimony in other states. They will hear things from some of the opponents that if there's right to repair passed, consumers are going to take out a scalpel and do their own pacemaker repair. Now, I laugh because I know that's completely absurd, but not everybody laughs. So it takes a little extra education to explain to people what you are allowed to do in a medical setting, how the regulations work, what the requirements are, what the training is, and it just takes time. So I'm very glad that you have the option of allowing us to speak to you about those issues. I brought along two real experts that can answer questions. Scott McKeel is at Mass General. He's been a biomedical engineer for, I think you said 24 years. Anyway, Scott will give you his bio. And then Bin-Seng Wang, who has been on the approval side. He's very involved with what the FDA does. He can talk about the third party world, and he's also going to be on the line. So he will answer those questions, I think, quite adequately. Legislators make choices all the time about what they're going to bring forward. Right to repair is a very large bill, but it's also the same bill. It doesn't really matter. We don't care what the computer is. If the computer's in a refrigerator or a tractor or an MRI, to us, it's just a computer. And it gets fixed in the same way as any other computer. So the skills that you need and the tools that you need are pretty well consistent, regardless of what the product is. So I just hope you will listen to Scott and to Bin-Seng and come back to us with any questions about what's going on in other states. Some of the bills have already passed or are being passed, by the way, have included powered wheelchairs and other in-home technology. So there is quite a bit of hope there for this bill to be expanded so that people that need to do things in their home can. So questions along those lines, happy to answer. So right now, I think I'll just introduce Scott and ask him to take it away.
Hey. Scott, welcome.
Oh, you're muted.
Oh, there's no audio.
We can't hear you.
No audio. Got to find another button.
I feel for the guy.
I know it works. I talked to him yesterday.
No.
No,
Okay.
Zoom
Shall we
does have
jump-
an option.
Yeah, could we jump to Bin-Seng?
Yeah, just want to let you know, Zoom does have an option that you can have it go through your phone. If you click on the mic, the drop down, it'll say switch to phone, and then you can call in and do whatever it says, gives you instructions. Can we send
Why don't
him?
we move to Bin-Seng and then
Yeah, let's work on that
get Scott back?
on the side.
Yep.
Okay. I don't know what that said.
Go to-
Do that say.
He needs a technician.
He's from the. Yeah. Right.
I'm sure they've got some good IT people over there. to help.
Bin-Seng is he on Zoom? He's not on the Zoom.
Eh,
The telephone instructions. I think it on it, I say, I'm just gonna send it, but yeah. I think that is.
Well, while we're kind of dancing around waiting for somebody to get on, there's a couple questions that came up that I think I can answer for you if you would like. In terms of what the training requirements are. You can't just show up and knock on the door and say, hey, lady, can I fix your MRI? I got spare parts in the back of the truck. That's not how this particular industry works. You don't get access to hospitals without having proper credentials. And that was even bigger during COVID than it is today. So nobody's coming into your facility saying, oh, I can fix this. I know how to do this. That's just not how the business works. Third parties that are skilled, that have the qualifications, that have the engineering certifications, those are not provided by the OEM. They're provided by colleges, like at UVM, the College of Engineering certifies engineers for biomedical engineering. So it's not random, it's not arbitrary. There are a number of OEMs that provide training courses, and they're costly. Scott, you with us?
No,
Yay. No,
no, not yet.
not yet. Okay.
I have one question I could ask Gabe.
Yeah.
Is your reading of this bill, does it include the right to repair wheelchairs that are not powered?
It's, well, I don't think it's specific to its power supply. Might want to ask, who was it that was speaking earlier that was going through the requirements? This version of the bill I haven't looked at in a while, but powered wheelchairs have had some specific problems where the manufacturers have refused to do things like replace a battery. And it's this power supply for the wheelchair that's been the contentious part. I think it's called assistive technology in the bill. And unless the definition from the FDA says assistive technology does or does not include a power supply, I would lean on the FDA definition. We're not trying to do anything to FDA definitions. We're not trying to do anything that changes anything other than make sure there's more availability. And with availability comes the option of competition. And with the option of competition, you can get into cost control. And that's how it all links together for, let's call it resource constrained places like Vermont and like upstate New York, where I live. By the way, I will
There we go.
Oh, there we go.
Can you hear me now?
I can hear you and see you. Wonderful. I'm gonna get
so
off the
sorry
call.
about that.
Oh, no problem.
Our IT department kind of makes it difficult to add new devices. So seeing as how you can hear me. Here, I'm J. Scott McKeel. I'm a CBET. I passed the exam in 1994. I work at Mass General. I'm not speaking on behalf of my employer. I've been a biomed since 1980, and I've been a hospital biomed since 1994. A member of the New England Society of Clinical Engineering, the American College of Clinical Engineering, Biomed of the Year in 2018, and the FDA had me testify in 2016 and 2018 when they were investigating medical equipment repair. And, you know, a lot of my contributions showed up in the Federa 710 report, in which the FDA found that medical equipment servicing by third parties was safe and essential to the healthcare industry. So I was a big part of that, and I've been part of that right up until 2025, when the collaborative community that was supposed to be convened between manufacturers and hospitals was disbanded due to lack of support by manufacturers. My opposite number there from AdvaMed didn't tell you the whole story. Sure, manufacturers are regulated by the FDA, but hospitals are regulated by the Center for Medicare and Medicaid Studies and their accrediting agency, the Joint Commission. And we also follow NFPA 99, the U.S. National Healthcare Facilities Code, which tells us everything that we need to know how to make medical equipment safe for our patients in our hospitals. We wouldn't be in business if we had biomeds in hospitals doing unsafe things with technology. And, you know, whenever a medical equipment manufacturer or a third-party service company visits our hospital, their visit is vetted by the biomed department or clinical engineering department. And, you know, we review the repair and accept it and sign off on it. So that equipment is double inspected after a manufacturer's representative might come in here and do their work. So I'm here to support H160. Thank you for having me. And I know quite a few people up in Vermont at UVM and the program up there. And you guys have one of the best programs in the world up there. And I urge you very much to support them and pass this bill. And I really appreciate the comment on behalf of the U.S. military because they need this too. So for me, this is a real problem every day at the bedside. What I do for a living in the OR is I go into the operating room during surgery and help the doctors and the nurses with the technology. My core specialty is anesthesia systems. And our anesthesia manufacturer sells us parts, gives us service manuals, gives us training, and I literally have to repair anesthesia machines during surgery with the patient on the table. Replace a sensor that's failed, replace a line that has started leaking. I've even had to replace ventilator parts while the ventilator was paused during surgery. So that's the criticality of the level that I work on. When we talk to doctors and nurses, I'll say, biomeds are like the white blood cells of the hospital. We always come when you need us. You never hear a stat page from an operating room. Manufacturer's rep to OR7 stat. What you hear is biomed to OR7 stat. And we definitely need the service manuals. They're like the DNA of medical equipment. We need parts. And at this point in time, we're really having a hard time of it. All of our major vendors in the industry are saying no and to giving us service manuals and parts. And your bill would go a long way to helping that. As an example, we have surgical tables. We have over 100 of them, and we literally have companies that are telling us that, oh, sorry, we're not going to sell you a part for that surgical table, that specialty surgical table used in critical cases. You have to put it on a pallet, put it on a truck, and ship it to us. And the cost of shipping that table is on the hospital to the tune of around $3,000 just for the freight. And it comes back in that they have, $15,000, $20,000 of repair and $6,000 of freight going on there. And one thing you should really know about how this goes is for us to pay $1 out on the back end of most healthcare facilities, $4 of revenue has to come in. So that $3,000 for shipping is actually $12,000 impact on hospital revenues. I've had a specialty piece of surgical equipment that the vendor in upstate New York says, oh, we're not going to let you work on that, but we'll send the person to do the maintenance and calibration. And it's going to cost you $5,000 in travel and labor. The guy is literally here for 30 minutes, uses his software key to open the device, does the calibration, and leaves. And that'll be $5,000. Thank you very much. but the impact to that on the hospital's revenue is $20,000. So there's a huge cost component. Uh, I can't tell you enough how important it is for your legislature to actually do this and pass this bill and to not pay any attention to the scare tactics from my opposite number in AdvaMed. So if Vermont enacts H-160, it would set a national precedent and immediately strengthen both Vermont's healthcare system and the U.S. healthcare system. For Vermont, this bill would empower the highly trained clinical engineering and biomedical professionals already working in your hospitals, giving them the tools and information they need to keep critical equipment operating safely, reliably, and without unnecessary delays. Nationally, Vermont's leadership would demonstrate that a modern, patient safety focused approach to medical equipment servicing is both feasible and essential by becoming the first state to adopt a medical right to repair framework. Vermont would help shift the country towards fairness and equity in technology support, reduced downtime, stronger resilience across healthcare systems, benefits that directly support patient care and the professionals who deliver it. So that was kind of like the statement that I wrote. Uh, like I said, I just can't emphasize enough how much it would mean to people like me in the trenches at the bedsides if you guys were to pull this off and make it happen. Do you have any questions for me?
Yeah, thank you so much, Scott. So in your professional opinion, would this bill improve patient care, reduce costs without sacrificing safety?
Absolutely, without a doubt, because one of the things that can impact patient care is a critical piece of equipment fails or becomes broken. And if a biomed in one of your hospitals can be called there immediately to the scene and has access to the tools, the knowledge, can go into the diagnostic menu with a code and resolve that problem, that patient just has a few extra minutes in the waiting room, as opposed to if that biomed is not empowered to do that, the clinician has to come out and say, well, we're sorry. You know, this appointment that you waited 3 months to get, well, you're going to have to go home and wait some more because the piece of equipment is down and we have to wait for the company to come and service it. I mean, that happens really. Uh, that's a real thing that happens, impacting clinical schedules, patient appointments, and things like that. Uh, I can't emphasize enough how frustrated I get when a piece of my technology is malfunctioning and I can't help my caregivers immediately. Uh, that's the big thing. And once again, don't worry about AdvaMed scare tactics because it's not valid. You know, it's just not a real thing. It doesn't happen in real hospitals. You know, biomed and biomed departments are absolutely safety driven. The Joint Commission that certifies us, sees to that. We have risk management departments. We have quality departments. We have every bit as robust a quality system as they do. It's just not their quality system. When they say to us, oh, you're not regulated by the FDA, blah, blah, blah. Well, it's like saying, well, why doesn't your baseball team play by football rules? Well, they're two completely different things. We don't use or follow their rule book, and so what's the point to their argument that we don't follow FDA regulations when we have CMS and the U.S. National Healthcare Facilities Code? It's just different. It's not that we're not regulated. And when we have third-party servicers into our organization to do stuff, they're very highly vetted, observed, and a biomed is monitoring their work and signing off on it. It's not like they just waltz in, do something to a piece of medical equipment and waltz out. That's not how it works in real life. Back to you.
Great, thank you.
You ever had a situation where, we've talked about software keys or things like that, where lack of access has forced a doctor to abort a procedure?
So I can't, yes and no. And Sitting behind me in the blurred background is our expert on cardiac ultrasound systems. And it's the darndest thing. He was sent to the school. We paid to send him to the ultrasound school. Yet all he can really do is diagnose the machine and do a minor maintenance on it. And yet, if he were to have to do a major repair and replace a component or subsystem, he has to call in the vendor to use their software keys to open up the machine for the parts to be put in. And, that's, thousands of dollars in expense that we wouldn't need to incur if they, instead of playing that game with us, just gave him the access key so he could install that part, test it, and get the piece of equipment back out into the cardiac OR right away. There are a lot of things that we could repair if we had the access keys into the software. Because that's one of the things that's happening is these medical equipment manufacturers are designing service models and service systems that intentionally lock hospital biomeds out of the system because it's a huge profit model. The service after the sale is a huge deal to them, and they're doing everything that they can with software to lock us out. And over and over and over again. I literally have a piece of equipment right next to me. It's a plastic box with a pump in it, and the company is adamantly refusing to give me a service manual or help me out, with repairing it. It's just ludicrous how far the pendulum has swung in the wrong direction, and I really honestly hope that the state of Vermont swings it back the other way, especially with how distant you can be from some of the service providers down here in the lower half of New England. I mean, your hospitals must get killed on travel hour billing on some of this stuff. I was a lab equipment tech for quite a few years, and I remember how much it was to drive up to White River Junction, and my hour billing on some of those calls was like a lot more than the labor of doing the lab analyzer repair. And back to you for more questions. Thank you.
Any other questions?
Like them wanting to see it on the B series monitor and what was what.
Okay. Thank you, Scott.
Well, thank you, and good luck with the bill. And I'm really hoping for it.
Thank you. We have Vincent.
Yeah.
Vincent?
Yes, I'm here. Thank
Good
you
afternoon.
for, good afternoon. Thank you for allowing me to testify. Honorable Chair Markert, Vice Chair Granning, and members of the committee, I'm deeply honored and humbled to testify on H-160. In the interest of time, I'm not going to present the full written document that I submitted to Jonathan. I hope you have a copy. And I'm going to basically provide a summary of what I provided and then try to answer your questions. First, let me introduce myself. I have earned a Doctor of Science degree from the Massachusetts Institute of Technology, MIT, and worked for more than 30 years in the 3 largest medical equipment service companies here in the United States as their vice president for quality and regulatory affairs. Those companies were Medic, Aramark, and Sodexo. In this capacity, I oversaw servicing of more than 1 million pieces of medical equipment deployed in over 350 hospitals around the country, varying from small rural hospitals to major teaching hospitals. I also had the privilege of working for a few American manufacturers of medical devices as their quality and regulatory compliance officer. and serving as their liaison with the FDA. Hence, my comments on H160 is not based on a single stakeholder's perspective, namely medical device servicer, but a comprehensive and balanced opinion that considers the challenges and interests of all stakeholders, with the ultimate goal of providing the best and safest medical devices at reasonable cost for the benefit of the patients and healthcare providers. During my 30+ years of work in the medical device field, I participated in the provision of critical medical equipment during several major national emergencies, such as the Oklahoma City bombing, 9/11 attacks, Hurricane Katrina, and the recent COVID pandemic. In these emergencies, the prompt availability of safe and reliable medical devices is essential for the care of the victims and save their lives. While most manufacturers were quite willing to help, they simply did not have the necessary manpower in the right places and at the right times. So most of them during these emergencies agreed to provide the in-house biomed staff like Scott, who just testified before me, and independent service organization like the companies I used to work for, with the service material, documentation, tools, etc., parts, so they can provide the clinical staff with the essential equipment that can be repaired promptly and revived in order to support the patient, such as the ventilators, infusion pumps that you saw most likely during the pandemic. Unfortunately, after these emergencies, many manufacturers decided to fall back to their traditional position of refusing to provide those service material, alleging several concerns, some of which I would like to address next. The first and foremost that is often mentioned is patient safety. And as Scott mentioned, the Food and Drug Administration was mandated by the Congress to investigate the safety and quality of services provided by third parties and submitted a report to the Congress in 2018. And I'm going to quote a few of their conclusions, which I actually provided you with their executive summary in the written document. The first conclusion was that the objective evidence indicates that many OEMs, manufacturers, and third parties, entities provide high quality, safe, and effective servicing of medical devices. Second conclusion, the continued availability of third-party entities to service and repair medical devices is critical to the functioning of the United States health system. And the third conclusion was that a majority of the comments, complaints, and adverse event reports alleging that inadequate servicing caused or contributed to clinical adverse events and death actually pertain to remanufacturing and not servicing. In other words, most of the so-called poor servicing incidents were actually remanufacturing activities that were likely the results of services too eager to help the healthcare providers with the prompt repair, but did not have access to the specifications or documentation that they asked for the manufacturer to provide, and therefore they ventured outside of the boundaries of servicing. And this issue called remanufacturing was actually addressed later by the FDA in its guidance document that was published in 2024 called Remanufacturing of Medical Devices. And also, I think some manufacturers have alleged that in that FDA report, the FDA reviewed more than 4,300 medical device reports that included death and serious injuries. but their conclusion was not apparently relayed to you folks, and I'm going to read it here. Quote, due to the limited information contained in the 334 MDRs of death and serious injury, we were not able to establish a conclusive relationship between device third-party entity servicing and the subsequent adverse event, unquote. In other words, even FDA was not able to establish this relationship, so I don't think we can blame the services necessary for some of these incidents. The second point that I would like to emphasize and discuss is the regulatory oversight. Repeatedly, manufacturers have stated that there is no oversight. That is actually not true. In that same 2018 report, FDA stated unequivocally that it has full authority to regulate servicing. That is part of the Food and Drug Act that they are upholding for the entire nation. And the reason that I'm going to quote FDA here is that it says, the current available objective evidence is not sufficient to conclude whether or not there is a widespread public health concern relating to servicing, including by third-party services or medical devices, that would justify imposing additional different burdensome regulatory requirements at this time. In other words, FDA itself reviewed the material, the complaints, etc., and concluded there is no reason for them to impose additional different burdensome regulatory requirements. But it is within the authority to regulate if they want to, and if they detect a problem, they will shut down a particular service company or manufacturer even if they deem that company is not following the regulations. In addition, I'd like to remind you folks that you know probably better than me, the Centers for Medicare and Medicaid Services, CMS, which is a sister organization of the FDA under the Department of Health and Human Services, also has strict requirements on the servicing of medical devices to the hospitals that participate in the Medicare and Medicaid program. And those requirements are transferred by the hospitals to the third-party services as well. So the bottom line here is that FDA has full authority to do whatever it deems necessary, but has chosen not to do it because they don't see such a significant problem. I'm going to go off tangent a little bit here to say that some people may not agree, but regulatory oversight is necessary, definitely. I don't disagree with that, but I don't think it is sufficient to ensure safety and quality of medical devices. For example, the FDA's own recall database showed the number of device recalls per year has been increasing continuously in the last couple of decades. And by the end of last year, 2025, there were 331 million devices under recall because of manufacturing problems, not because of servicing problems. And the United States Government Accountability Office, GAO, reported back in 2011 that the FDA needs to enhance its oversight of recalls by, quote, using, unquote, continuing, quote, recall data to proactively identify and address the risk presented by unsafe devices, unquote. So the bottom line here is the real challenge is not the lack of regulations, but the lack of enforcement of regulations by the government. Another favorite topic by some manufacturers that are opposing the right to repair is the intellectual property and service revenue issue that was already mentioned, but I'm going to quote specifically the fact that the European Union, EU, has mandated the release of service material except for the maintenance software access since 1993 and reiterated this mandate in 2011 when it issued the most recent medical device regulation. So if such right to repair mandate will cause manufacturers to suffer substantial losses of intellectual property or service revenue, one would think that they would have ceased their operations in the European Union and moved their business elsewhere. But the same manufacturers that are complaining about opposing right to repair here in the United States, they have been doing business for more than 30 years in Europe, and some of them are actually headquarters in Europe. So why are they complaining about it here in the United States if they already follow similar regulations in Europe? I'm going to skip over cybersecurity risks and the alleged exemption in the Federal Fair Repair Act that have been mentioned by some of our OEMs that are opposing our right to repair the H160. I just want to remind folks that there is a significant clear precedent for right to repair for medical devices, not generally, not all medical devices, but one particular class of medical devices called powered wheelchairs. Powered wheelchairs are classified by the Food and Drug Administration as Class 2 medical devices. In other words, the same class as the infusion pumps that you see very often in hospitals. So this is not a precedence. This is not unique. This is already happening in Colorado, California, Nevada, and Oregon, and Washington State. In essence, I believe that right to repair is critical for safe and prompt delivery of care to Americans, especially for those located in rural and remote areas, which have been struggling to survive over the last 2 decades. Many of them are at the risk of closure. Even for hospitals located in the metropolitan areas, right repair allows them to keep using their medical devices safely and effectively much longer than their estimated useful lives, thus avoiding premature replacement and saving precious investment capital. Furthermore, by extending the device useful lives, it is possible to help contain the accelerated rise of healthcare costs, reduce toxic waste, and lessen detrimental impact on the environment. Therefore, I respectfully urge you to advance H160. Thank you for your precious time and attention. I shall be happy to answer any questions now or via email and telephone later. Thank you.
Thank you.
Thank you.
Lee?
Just a quick one. Thank you so much, Dr. Wang. So in your mind, would this bill help control costs and extend the general life of equipment the hospitals are using?
Absolutely. Actually, when I was working for one of those service companies, namely Sodexo, we investigated more than 300,000 pieces of equipment that were maintained by that company for the last 30 years. And we saw that through good maintenance and management of equipment, we were able to extend the lives of those pieces of equipment for more than double the amount of years that are estimated by the American Hospital Associations as their so-called useful lives. In other words, double the amount of years. This is like extending the lives of your cars, automobiles, by taking good care of them, and therefore you most definitely can save precious capital and also, more importantly, take better care of your patients who are in urgent need typically of prompt care. Thank you.
Thank you, Dr. Wang. Is there have you, in your experience, Has there been a difference between the service that you get from rented or leased equipment versus what is owned by a hospital or institution?
Not necessarily. It depends, again, who is taking care of the equipment and how well they take care of the equipment. I'm not going to be able to provide names here. I don't want to create particular concerns here, but there are definitely companies and hospitals who are extremely careful in doing their work and provide safe and effective service like the FDA has investigated. But there are definitely also not only service companies, rental companies, or loan, but also manufacturers. Have you seen some manufacturers provide very poorly made designed equipment, only have been then later on be forced to recall them. So bad apples do exist, and we need everyone to be responsible doing what, for example, you see in airports. If you see something, say something. And that is, I think, our duty. But the bottom line here is that the vast majority of the professionals in the field, doesn't matter whether they work for a hospital directly or they work for a third party, but as stationed in hospitals, or they are working in a depot location farther away from the hospital. Most of them, to the best of my understanding and also directly contact with them, they want to do a good job. Because at the end of the day, we are very mindful that our loved ones, including ourselves, I'm old, you can see from my white hair, I am a patient. My loved ones can be patients, and we don't want to see anyone suffering because of poor service of the equipment that we took care of and then provided back to the clinical users. The clinical users also get frustrated if we don't provide them with safe and reliable equipment. So this is a concern, a goal, I think, of everyone involved. There are only a few people who are putting money, greed above the public interest here. And I think those are the ones that we need to address very stringently, carefully. Thank you.
Last question, Jonathan.
Very briefly, thank you, Dr. Wong. The question I had pertained to a portion of the testimony you provided, where you described service material as not only the documentation, tools, and parts as defined in H160, but also detailed technical specifications of the device and its components. Are you, is it your suggestion that the language in the bill is overly restrictive and as written does not include those necessary technical specifications of the device and its components?
No, I'm only saying that it could be benefited by expanding a little bit. Let me give you one example that was cited actually by the FDA as a remanufacturing issue and not a servicing issue. There was this ultrasound probe that is used by the clinicians to put inside the digestive tract of the patients to see what's troubling them inside their stomach. Okay, there could be ulcer, cancer, or something. So they use this ultrasound probe going into the mouth and then deeply into the digestive tract to see what's going on inside. The probe broke. So they asked someone to repair the probe. The probe was repaired. It was something that was loose or broken inside, whatever. But they needed to seal the probe back in order to allow it to be put into the patient, because you don't want to leave the leak opening there that would allow introduction of fluid and also germs into the patient. So the service company people try to patch that piece back together by using a generically available glue. Okay, that is unfortunately not the original spec by the manufacturer. The manufacturer did not provide the specifications, and that glue was not tested for biocompatibility when it was used. So that was a clear case of someone trying their best to provide prompt service to the clinicians, but actually went beyond the limits because they didn't know what was the specification. So they just said, okay, let me use the first glue I can find that is seems good, reliable, but was never tested in terms of biocompatibility. So that is why I think specifications must be included in this combination of service material that we are asking for. I hope I answered your question.
Thank you.
Okay. Thank you very much. We have to move on to our next bill, but we appreciate your testimony and your time that you gave us today.
Thank you.
Thank you. Thank you, Scott. Jonathan, can you see if Maria's outside the door?
She's here.
Oh, yeah.
How are you doing?
There you go. He just moved on spot.
Don't do it.
Yeah. Do you want a couple?
Sure.
Okay. I should do something.
Thank you.
Where do you go? Well.
Rubbing up on here.
Ready to go.
Ready to go. Maria Royal with Legislative Council. And now sharing my screen. So this is draft 1.13. And I've highlighted the new revisions. Everything else that wasn't rejected or has been incorporated, and then the items that were still to be determined are still to be determined. A couple things I just wanted to mention. There are some kind of drafting things that I noted for clarity, which I'll point out, and then you let me know if they make sense to you. And then also, just to let you know, the items that judiciary is working on, the provisions that have to do with the debtor disclosing the identity of the perpetrator, trying to get a better handle on that. And if there are situations where a court might compel a debtor to disclose the information to the creditor. And then also the procedures in a civil action about when a judge can take protective measures, sealing records and remote hearings, so on. And one more, the statute of limitations with respect to a creditor's right to sue, trying to tighten that up a little bit. So those are in process. So with that, there was actually a question that came up in judiciary about whether or not you needed to specify that the report the law enforcement report is actually an official valid report? I think the answer is no. If it's not valid, you're not gonna have a very good claim and it's inherently official, so I think you're okay not specifying that. This next change on 13, this is actually something that I'm suggesting, provided it doesn't change the substance, because you remember that you had those two separate subdivisions, a police report, and then this section, but they're very similar, so you kind of collapsed them into one subdivision A. And so the way it reads, I don't know if you need that language that's proposed to be stricken here, if that's redundant with what comes next. So a copy of a report filed with a federal, state, or local law enforcement agency that identifies the coerced debt and the circumstances under which the coerced debt was incurred. I don't know if you need to have that kind of lead-in language that the report is regarding the debtor's claim of coerced debt, but if you disagree, no problem putting it back in. The other, again, this is a suggestion on line 19, is just striking the word written so that throughout the document, you're just referring to a sworn certification. And then in the definition, it specifies that it's written. It just seemed less wordy. And then also, a third-party professional regarding the debtor's claim of coerced debt based on information gathered by the third party while acting in their professional capacity. I think you can delete this because under that certification, it says, I certify that in my professional capacity, I met in person or in Zoom and made a professional determination. So I think it might be redundant, not necessary. You can mull it over. And then similarly, there was some language added to the definition of debtor, which I think can be just collapsed into this definition of coerced debt. Maybe we'll go to the debtor definition first. So originally you had a debtor means a person who owes coerced debt and is a survivor, domestic abuse, or a vulnerable adult who's a survivor of abuse, neglect, or exploitation. There was a provision added here saying, and the coerced debt was incurred as a result of the domestic abuse, human trafficking. That to me seemed more applicable in the definition of coerced debt. So that the real language difference was the as result of. So I think if you incorporate it here, coerced debt means all or a portion of secured or unsecured debt solely or jointly in a debtor's name that was incurred as a result of domestic abuse, human trafficking, or the abuse, neglect, or exploitation of a vulnerable adult and the perpetrator's use of the information or use of threat or force. So I think that works. Let me know if it doesn't. On line 12, there was a suggestion just to delete that language about the debt with not being subject to a default judgment. And just leave if, it's not coerced debt if it was subject to a final judgment where the court actually adjudicated the issue of coerced debt. So we already went over the proposed changes in the definition of debtor. Oh, another change. It would be a lot simpler to just refer to perpetrator throughout the bill rather than perpetrator of coerced debt. You'll notice, though, that under this definition, perpetrator means an individual who causes or is alleged to have caused. And that's significant, particularly in the civil remedies, that you're talking about an alleged perpetrator, but it's already incorporated in the definition. So just depends on the context. Yeah.
To make sure I understand.
Yeah.
An individual, thinking here of a debtor, how we describe as a vulnerable adult who's a survivor of abuse, neglect, or exploitation, as those terms are defined. The way those terms are defined does not prevent a person from being considered a vulnerable adult if the perpetration is alleged?
Not sure.
There's the perpetrator is someone who is alleged to have caused or caused, it could be,
Yeah.
it could be an
That's the
allegation.
that's the claim that they're making is that.
And you can be defined as a vulnerable adult if the allegation is just an allegation. So that's what I'm just trying to make sure that that the definition of a debtor who is a survivor of something, can the thing still be alleged if the person is known to be a survivor? Can you be a survivor of an alleged act? That's all I'm trying to understand.
Oh, I see what you're saying. Well,
I don't know if 33 BSA is, maybe they treat of that in a way that I'm
just using that term survivor
Yeah.
is
I see.
is that what you're mostly?
I guess I'm wondering how when we're giving cover to an allegation, you don't have to
Sure.
prove in something, and I'm wondering if the definition
Okay,
of
yeah,
survivorship.
I think I understand your point. I think that would come out in a legal process if that were being disputed. Like there was no domestic violence. There was no abuse of a vulnerable adult. Like, I think, is that what you're getting
Yeah,
at? Like, that could be argued as a,
Yeah, my hope is just that a survivor wouldn't end up having the cart before the horse because of, it's like, well, this has to be shown under 33 BSA 69, but the perpetrator is only alleged. And I just don't
Yeah.
want to leave survivors.
that's a good point. I mean, I might be missing something, but I think it kind of all comes together, but I'm
I'll
not
read up and think
certain.
about
Yeah,
it.
yeah, I'll mull it over too, and maybe someone else can help clarify that. This next change on lines 11 and 12, this was a suggestion actually from judiciary. Qualified third-party professional means any of the following individuals who do not have a conflict of interest. Then with respect to subdivision C on line 15, I believe Representative Graney, you raised the issue of whether a licensed social worker or a clinical mental health counselor is considered, you'll see on the top of page 4, a healthcare provider, and the answer is yes. So, maybe not a reason to call them out specifically because they're already under that broad definition. So what would be left here is a crisis worker, employed at a program that assists vulnerable adults or survivors of domestic violence or human trafficking, and who has relevant training or experience. Just so I'm understanding, so the crisis worker has to be employed at a program in order to be able to provide services. So I guess what I'm wondering is if you have somebody who is licensed but not employed, or if you have like if somebody's like a certified clinical social worker and a like registered first responder or first mandated reporter or something like that, like. Well, a social worker would fall under the healthcare provider, right? But I guess maybe I'm thinking more of mandated reporters. And I don't know if crisis workers are mandated reporters. They might be under their definition, but there was. Also mandated reporters are teachers. Right, but there was a request that for crisis workers, they be employed at a program. You're right that you could be a volunteer, but that's a policy question.
Can I have a little information here? So the list of qualified third-party professionals is the list of people who can certify the official documents.
Okay.
And so that's why it's limited in order to come to an agreement with the lending institutions.
Okay, I understand.
It's very clear on who is eligible for it. Yeah.
But that wouldn't necessarily preclude the person from seeking treatment.
Oh, no, right. Oh, I'm sorry. No, not at all. Okay. Oh, so this is just having to do with the disclosure or
non-disclosure of the perpetrator's name. So I just making a note that this is something judiciary is gonna be looking at a little bit further. And then there was a suggestion made last time you took testimony that a statement of coerced debt by the debtor shall be notarized or shall include the self-declaration. So just adding another option as opposed to just signing under penalty of perjury. That was a request for your consideration. And then here you'll see just striking out written and sworn certification, but including it as part of the definition. Line 16. And so, again, just to clarify the connection, the relationship between the third-party professional and the debtor, I am a qualified third-party professional who has had in-person contact or face-to-face contact through an electronic medium with the debtor based on my professional interactions with the debtor and information presented to me in my professional capacity. So I think it covers everything that had been included before. So then, okay, so now we're getting into this section about the creditor's conduct once they've been presented with the statement and the documentation. And one of the things I've been trying to ensure is that the process here in terms of the creditor's duties with respect to information that's in a credit report, that what you have here is consistent with the federal requirements. Under the federal requirements, the creditor has 30 calendar days, which is why I propose striking business days here. However, when it's only 5 days on line 11, they specify it's 5 business days. So this is just consistent with what's required, and I think you're preempted from changing that time period. Again, these are the creditor, in this instance, is the furnisher of information to the credit bureaus when they're directly in receipt of a dispute about an account. It triggers this time period. They have to notify the agents, credit reporting agencies, that the account is being disputed. And then again, if they determine that in fact the information in the report is inaccurate, but this is all controlled by federal law.
Yeah, sure. So I'm thinking about, I think in subsequent meeting, we added the term sworn to the statement of course, Dad. And I take that judiciary, later on, when you got the actual form for, I think that's what it is, added in the word notarized or.
Oh, that was actually a suggestion that came up in this committee from, I think, legal aid. They wanted to provide the option. It could be notarized or it could be the self attestation in lieu of a notary.
Right. Right. I'm just wondering whether the notarization covers the same purpose as being sworn.
It is. It can be either or. But I think they wanted it to be an option, like, so you don't have to get it notarized.
Yeah, I'm maybe.
Does the notary
It's
hold
not-
that person to the same accountability as them swearing to it? Is that your question?
Yeah, and I might have this wrong, but I always understood notaries are as affirming that you are who you are, as opposed to affirming that the
Say what you
statement,
That the statement
The
is.
statement is true.
So I may be way
Oh,
off base.
okay.
I just
Okay.
wondered about that, from the legal, whether
Okay.
notarization is being used as a
Sufficient.
substitute for the being sworn.
I see what you're saying. Okay,
Maybe think about it.
yes, let me just see, I'm just wondering if there was any other.
If they're notarizing the person saying that they're a qualified third-party professional who believes this, is that the same? I hear you. I'm not sure.
This is for the statement of the debtor.
Right.
Right, so,
Only
Yeah.
the statement.
yeah, that's a good point. That's true. They're not. attesting to the accuracy of the information. So, yeah, good point.
On that, I mean, we talk about vulnerable adults and things like that and children. Are they, because in some contract law, I mean, you may not be qualified to make your own decisions. Like a child under 18, any contract with them is unenforceable.
Right.
And if you have a vulnerable adult who may not be mentally capable of making those decisions, you know, how can they self-swear when they're not?
Yeah, I think that's a great point, but I'm guessing the law provides for that. You can have a guardian or caretakers act on your behalf for legal purposes, but that would already be. So I can check with Michelle and see. I mean, I think she handles more, but I'm pretty certain, just like a parent would naturally be able to sign on behalf of it. I think that there are provisions so that they can legally enter into contracts even if they have a disability or other vulnerability.
You know, is there any issue where that guardian or parent could be the perpetrator? And how is that handled?
Sure. That's quite possible.
Just say the third party.
Right?
Yeah.
Yeah, so,
There's a list of qualified third.
right, so you need the third party or a police report. So would they go in and say, I am the perpetrator and I'm bringing this claim on behalf of my, right?
Mhm.
I mean, which isn't to say there might not, I don't know what people did, but yeah. So, still to be determined, the creditor's response once they've done their general investigation as they're required to do and made a determination. I'll just go back a little bit here. Line 11. So within 5 business days of making a determination under subsection C, the creditor shall notify the debtor of such determination in writing and shall provide a good faith basis for the determination, including identification of the evidence relied upon, and just specifying that the notice shall not include personally identifiable information of another person. And then if the creditor determines the disputed debt is coerced debt, the creditor shall notify the debtor that it is ceasing collection activities and contact any consumer reporting agencies to which it furnished adverse information about the debtor's coerced debt and request that such information be deleted from the debtor's file and credit report. If the creditor determines that the available information does not establish that the disputed debt is coerced debt, you have some options to be decided. They can resume or recommence collection activities, at which point it would be up to the debtor if the debtor wanted to pursue the matter further, going to court, seeking a declaratory judgment, the finding that it is coerced debt, or they could resume collection activities but not sell or transfer the debt, so they would have to maintain the debt in the event that there is ongoing legal actions, or they could cease all collection activities, and then it would be upon them if they wanted to enforce collection to go to court. There are probably other options, but these are just 3 for your consideration.
Can you explain the benefit of not selling or transferring the debt? I assume that's so that it doesn't hurt another entity or.
Well, if they were to sell it, if there is an account or debt in dispute, I think they have to provide notice to any entity who takes over the debt. I think this is more so that the original parties who are already involved, who have done the investigating, are still the original parties. It's not going.
Okay.
So this is the form that's provided to the debtor. Either they get it off of the CFR's website or from the creditor. There, I just made a couple of notes about things that are going to need to true up with whatever you decide about the collections. And then just some clarifying language regarding the supporting documentation. Again, this is just in the form which DFR is going to prepare. Please include at least one of the documents, which is also specified below, but just to make it very clear. And then this other language just tracks decisions that were made in the definition section for the definition of crisis worker. No other intentional changes. Again, just a note more for myself to make sure that the form matches with whatever you decide. There was a request in terms of the notice. So if the creditor decides to cease collection and requests that any adverse information be removed from the credit report, they can do that. But if they are not convinced that it's coerced debt, it says that they have the right to challenge your claim of coerced debt in court. And I was talking to Representative Graining about some notification that the debtors have legal protections themselves. So that's all this is saying. It says, yes, the creditor can try to enforce in court, subject to legal protections for victims of coerced debt. How much detail you want here, I don't know, but at least it's meant to put them on notice that there are some protections. And then again, just that the statement is either notarized or certified as true and accurate, however you decide.
Herb's.
Right.
I think it's really your statement, your signed statement is notarized. Because it's really, I think Herb is right, that I think your signature is what gets notarized.
Yes.
It's you.
Yes, yes.
They're not certifying as to the accuracy of what's in the document.
Correct. So these are the civil legal remedies, and these are kind of the issues that judiciary is working on. And then, so I didn't note every instance where I changed perpetrator of coerced debt to perpetrator. This is one of the proposals they're considering with respect to the statute of limitations for a creditor. They've not seen this language yet. Just to give you a sense of what they're thinking. So an action by a creditor against a perpetrator shall be commenced within 6 years after the date the creditor received the debtor's statement of coerced debt and adequate documentation, or received notice of the identity of the perpetrator, whichever is later. And I think those are all of the coerced debt amendments. And the only other thing that I had made, you had some concerns about the third party contact. This is under the suspicious transactions banking holds, about who a bank could contact. I didn't make any changes there, but what I did note, I think Judiciary Representative Graining noted that, this is that, let's see. So the authority to delay a transaction under this section expires at the earlier of 15 days after the date on which the covered entity initiated the delay. when the covered entity is satisfied within its sole discretion that the transaction will not result in financial exploitation, or upon a court order directing the release of funds, both, I think in this instance. And then relatedly, the second one is that it's not likely a court would be able to do anything within 15 days, so trying to determine if this actually was necessary to include, but I highlighted it. Not sure if it's necessary. And then the effective dates, I just highlighted, no changes, but it had been written wrong. That was a little confusing in the earlier draft, so just noting that that was cleaned up. So, this section, the effective date, complaints regarding claims of identity theft, that's a technical change. We haven't really talked about that, but it's in the existing law under the Fair Credit Reporting Act. It specifies you can report identity theft claims. It just had didn't have the complete cross-reference to the identity theft crime. So that would take effect immediately, as well as the suspicious banking transaction language, and DFR's report on suspicious banking transactions. So the section 1, the coerced debt, creditor conduct, civil legal remedies, and then the duty of credit reporting agencies to reinvestigate, those would all take effect July 1st, 2028. And again, shall apply to all outstanding coerced debt, including debt incurred prior to July 1st, 2028. That's
According to Fair Debt Collection Practices Act, if a debtor in writing requests no more communication, that means that the entity is no longer to communicate anymore, except for by a court order or what have you. Is that correct? Or
I'd have to look. I can look.
I'm
Yeah.
pretty sure, unless it's changed in the last 25 years, once a letter is received by whatever collector, they are not allowed to contact the debtor anymore, which changes if the account changes hands. It starts the process all over again. So if I have a debt on Abby, you send me a letter, I no longer can communicate with you. Then I give it to Herb. Herb can start sending you letters. That's the way that I understand.
No, it's, yeah.
Yeah, because I'm selling the debt. So when we're talking about those three options, I think that in order to avoid that process of, sorry, I'm not moving slow. Fast enough.
That wasn't you.
Oh, okay.
I'm
Oh, okay.
thinking out loud.
In order to avoid that process of, passing around the debt so that you can do the collections in that way, I think the creditor maintaining the debt is definitely an option that we should consider, if that's the way that the Fair Debt Collection Practice Act works.
And I'll try to find out while other testimony is going on.
Yeah.
Unless somebody knows the answer, yeah.
Yeah, they may know if it's a.
Yep. Any other questions for me?
Question for you or for other folks, but I remember that it's one of the times we were taking testimony and we were talking about those three options. And I think it was a legal aid attorney, but maybe it was someone else talked about, if you're gonna go with allowing the creditor to resume collection activities, I think she talked anyway about additional sort of credibility criteria. In other words, what the creditor would have to show to make a good faith determination that they're justified in resuming collection. Did anyone get in touch with you about that? I just didn't know if I didn't see it, but.
No, you're right. That did come up. I talked with Representative Green a little bit about that, and your can certainly
My
put it
recollection
in.
is right.
Your recollection is spot on.
yeah.
We're still trying to figure it out.
Yeah, there you go. Okay.
I'm wondering if there's a certain amount of time that creditor would have to hold on to the debt before it gets sold to a collection agency. So that it gives time for the debtor to determine where they want to go. What do they want to do? Would they want to go to court? Well, I think you can wrap that into option one, right? That where there's a certain amount of time that they would have to hold on to it. Something to talk about, I guess.
Just to be clear, I'm not expressing preference.
Yeah, no, I understand, but I'm wondering, after the period and I mean, I think making a determination that it's not coerced debt is a huge high bar for creditor to me. And I think, and I would almost doubt that there's gonna be any that are going to meet that bar where they're saying, no, this is not coerced debt.
Is there any independent third party that is not a court? Good, I mean, it's really,
I've been thinking.
we were all, we were.
Yeah.
Same wavelength.
Yeah,
Looking for an arbiter.
right, an arbiter, or, because the options are very good.
Again, I think it's what we're saying needs to be provided to the creditor in order to make the determination that helps the creditor understand if it is coerced debt or not coerced debt. She's on the list.
Thinking the citing estimate, but potentially on the same lines, I'm curious about when the debtor makes a statement of course debt and provides the material. If that material is not complete, or is there a back and forth between the debtor and the creditor? Is that there? Okay, sorry, I couldn't find it.
Oh, shoot, sorry. Where am I? Oh, no, gotta keep going. This section. I'll get there. Yep, so it's subsection B.
Okay.
So subsection A is you submit it. B is if the debtor notifies a creditor, but does not provide all the information required under subsection A, or provides the information orally, and it's required to be written. And assuming that the creditor does not then just decide to cease collection activities anyway on its own, then within 10 business days of the initial receipt of the information, the notice, the creditor shall inform the debtor that additional written information is required and shall provide the debtor with model form A1, which is no, sure.
Any other questions from Marie? Thank you, Maria. Sure. Sure.
Good afternoon.
Good afternoon.
Carly Glisserman, I'm the policy director at the Vermont Network Against Domestic and Sexual Violence. Thank you for having me in today and for your thoughtful work on this bill. I was reflecting this morning on just how it's been a pleasure to spend more time in this committee. and support your work on a really important piece of legislation. So there are a couple policy questions that I want to speak to, but before I do that, this may be the last opportunity I have to testify before you all vote on this. I want to reflect back on the purpose of this bill, which is to provide meaningful relief to survivors of abuse who would otherwise remain saddled with debt that is not their own. And it is designed to offer a process that's accessible to survivors, and that is different than what's available to them in the status quo. So not forcing them to proactively bring a legal action to access relief. So with that purpose in mind, I want to speak to the kind of big outstanding decision that this committee has that will in many ways determine whether the goal of this bill is really realized. And that's the decision about whether a creditor would need to bring a legal action to recommence debt collection after receiving a claim from a victim, or whether they can make that determination on their own and resume collection without any external check. And without a court action, a creditor will make that decision internally. And if they don't accept a victim's claim of coerced debt, the victim's option is to proactively initiate a lawsuit to access relief. And that is technically the option that victims have today. But that is not accessible in practice to survivors. Creditors regularly bring court action in collection matters. And this is really not the case for survivors of coerced debt, the vast majority of whom do not have legal representation. So we feel that this external check is critically important to ensure that the debtor, the victim, and the creditor use this bill as intended. And that when there is a true dispute about the validity of a coerced debt claim, that final decision goes to an external decision maker. And I do think that the appropriate external decision maker for that is a civil court. If the committee makes that decision, I know Representative Olson, you noted this question around like additional documentation provided by a creditor when disputing a claim. I don't think that that kind of additional documentation would be needed if there was that external decision maker, the civil court, making a determination beyond the language that is already included in this latest draft. I think the court process itself would provide that very important procedural safeguard. I have just recently reviewed this draft, and there are really just one thing that's kind of catching my eye around the changes to third-party professional definition in this latest draft. I admittedly am still wrapping my head around the impact of those changes, but I can certainly take a look, and if there's anything that we feel is needed to change, I'm happy to provide some language for your consideration by tomorrow. I also wanted to note on the question of a statement that's either a victim's statement of coerced debt, either being notarized or sworn under the pains and penalties of perjury. From my perspective, we're comfortable having all statements of coerced debt signed under the pains and penalties of perjury, as opposed to having all documents requiring a notary. Getting a document notarized is just more onerous for a survivor, and we feel very comfortable having them certifying to the direct accuracy of the statement, which could provide greater security to the creditor. So for your consideration. I will also note that we've been working with the House Judiciary Committee, as well as Maria and Michelle Childs, on some helpful revisions, I think, to the civil legal remedies section to clarify how a civil legal process would work in cases where one is pursued. And they're discussing this language in committee tomorrow afternoon, and we also appreciate their work. I wanted to thank you again for your thoughtful work on this bill and your commitment to supporting survivors in rebuilding their lives after abuse. It is greatly appreciated, and I would be happy to speak to any of these points in more detail or answer any questions.
So I will say that I think there's been a good collaborative effort going on between your organization, legal aid, and our financial institutions. I think there's a fine line that we need to walk here. And I just wanted on the record that, and again, this is something Chris has said and Carrie has said as well, that they haven't, the financial institutions haven't done anything wrong. They're not the perpetrator. They are at the table and have given in a lot. And I don't believe that financial institution, whether they're in Vermont or they're outside of Vermont, will go after getting the affidavits and everything, will say that this is not coerced debt. And I think they're taking on secured debt as well. So there's going to be debt that's going to get written off. I think the main part to this whole thing is to make sure that people that are having people coerce them into creating this debt have their credit cleaned up so that they can go out and get loans, and so it doesn't sit on your record. I think that's the biggest and main issue here. But also the debt that they may have to carry. Hopefully at some point, financial institutions can go after the perpetrator, because that's where the whole problem is with the perpetrator. So I'm really struggling on, looking at forcing the creditor to have to go to court. I know that they do it all the time, but I think in this instance, if they're coming in and saying it's not coerced debt and they found something that's really troubling to them, that it could be fraud. And to have a look back, far back do we go, I think is a problem too. So those are two pieces that I'm struggling with, of whether or not I can support the bill.
Well, I appreciate your transparency. And, one thing that I've also been struggling with as I've been thinking about this process and what is balanced, what is fair, is the reality that if a survivor is bringing a statement of coerced debt and there is not agreement about whether that is coerced debt or not, that will mean that to move forward, someone is going to have to bring a court action. And so the question then is, who is best positioned to bring that court action? And, you've heard from Vermont Legal Aid. You will likely hear again from the National Consumer Law Center, how survivors are really not well positioned to bring a lawsuit against a financial institution. They do not have legal representation or resources or information about how to go about that. And I think Legal Aid and Vermont Network, we wish that we could provide legal representation to every survivor who needed it so they could access relief. And we don't have the resources to do that. So that is why I think it is really important to have the structure as I described. And I know that the House Judiciary Committee is taking a look at the civil legal remedies section. And that includes, real details around how does this play out in court? And another committee looking at, is this going to be a balanced and fair process? Does that take into consideration the realities that both the survivor and the creditor are facing? And I also wonder, perhaps Andrea from the National Consumer Law Center, who's speaking after you, could share anything from other states around, has this external check been needed? What has it looked like? so that we can learn from those experiences as well as you're weighing out this decision.
Other questions for Charlie? Thank you, Chair.
Thank you very much.
Thank you so much. It's nice to see all of you again. Carrie Allen from the Association of Vermont Credit Unions. I'd like to echo the sentiment of what we've already heard. This has been a very collaborative process, and credit unions have been really appreciative to have had a seat at the table. We want there to be meaningful relief for victims of domestic violence, human trafficking, for adults that are in vulnerable positions and may be exploited. We see in credit unions around the state of Vermont how the impact on bad relationships and friendships gone awry, as Grace shared a story about her client that was exploited in an auto loan. We see instances of those in credit unions, and they can have a significant long-term impact on someone's credit report and ultimately then an impact on their financial stability. And we want this to be a bill that is helpful to moving forward and finding more financial empowerment for Vermonters. And we appreciate having been a part of the process. And there have been challenges where we may not all be in agreement. And I think we are much closer than where we may have started to finding a fair and balanced bill. I think the point of discussion that was most recently brought by Chair Marcotte and by Charlie is this identification of what were to happen in the case of a statement and all of the documentation being reviewed and a belief that this was not accurate as defined by this bill, and what would be the next steps. And I think, to Chairman Marcotte's point, I find it hard to believe there will be instances where credit unions in the state of Vermont would feel confident in suggesting this was a false statement unless we had proof of fraud. I think to go against a victim would be highly, highly unlikely, and we would not want to err. We would err on the side of caution because we certainly wouldn't want to be in a position where we were misbelieving someone who actually was a victim. So I find it very unlikely that there would be many instances where credit unions would actually dispute a claim of course debt. I think the documentation as well as the third-party qualifiers would make it highly unlikely that a real and authentic course debt claim would be disputed by credit unions. I heard Grace and the Vermont Legal Aid's concern last week that there may be debt collectors that might have different practices, but as far as Vermont credit unions would stand, I really feel that it would be highly unlikely that there would be instances where we made a claim that this was not in fact course debt and pursued legal action unless we believed it was a fraudulent claim. That being said, if it was determined that the statement and the documentation provided did not meet the definition of course debt as provided by this bill, then our position would be that therefore it wouldn't qualify for relief, so creditors should have the ability to commence recollection, right? That would be our position. Now, to your point, we would certainly be agreeable to say that we would not sell or transfer the debt to a collection or third party. We certainly could agree to that. But we would ask you to consider either one or two in moving forward to allow us to pursue what we would ultimately believe was a fraudulent claim.
Yeah. Carrie, if you determine through your investigation that it was a fraudulent claim, I mean, at that point, wouldn't you also turn it over to law enforcement, prosecution.
Yeah, likely, absolutely. Yeah, absolutely.
Can you talk a little bit about good faith basis and what that looks like? And just for the context, it's on page 8, line 13, and this is what we're asking the financial institutions to provide if they deem it not to be coerced debt. So can you?
Yeah, and I think at this point it says evidence. Is that correct? I thought it said evidence.
Page 8, lines 11 to 15, and it says the creditor shall notify the debtor of such determination in writing and shall provide a good faith basis for the determination. So it says including identification of the evidence.
Yeah.
Just identifying what it is, but I'm just curious, what is a good faith basis?
So I think part of our concern, and I've heard it last week and Charlie referenced it today, is the possibility of providing a similar level of evidence to the statement of course debt. And I think that would be really challenging for a financial institution to provide because it's likely that what we would have would potentially be a legal contract. And so it would need to be highly redacted to not include personal identifying information, or perhaps it could be an employee's statement who took the loan application and was a party to the transaction. And again, that would include personal identifying information that would be hard to share in a public setting. And so I think it would be challenging to provide that level of documentation back to a debtor. But I can imagine that if we were to say, for example, I'm making this up, but let's imagine we were to say, those aren't the parties that were there when that loan transaction happened, and they're the ones making the claim of course debt. If we had an employee saying that, then that would be a fraudulent claim that we would then investigate and move forward. So for us, that might be a good faith basis, but we wouldn't necessarily want to share that with the debtor in writing. Does that make sense? It's hard to.
Well, and that's what I understand. If I was asking for relief from coerced debt, would a letter back to me saying your claim for coerced debt has been denied, is that a good faith basis? Or could it be, is there more to it? And that's why I truly don't understand what we're asking.
Yeah.
Is in good faith basis. And I'm wondering if we need to ask that in a different way.
Yeah. And I think I'll go back to my original statement. I find it hard to believe that credit unions would, on its face, say, we don't believe this statement. That there would have to be information, potentially that a Social Security showed up on a credit report as being suspicious. It didn't align with something that we had documentation. Perhaps, a statement didn't align with the documentation. We needed to do additional review and research. But I find it very unlikely that we would just say, we don't believe this. That just doesn't seem reasonable to the ways credit unions practice today. And to Charlie's point, there would be a legal remedy for that.
I'm still stuck in, because we have our Vermont institutions that we know and have relationships with, and so many loans are with e-finance companies and other places. And if the way we have it written gives them the ability to just say, no, we're denying your claim, I'm not sure we've done enough to protect.
I agree. I agree.
I'm trying to understand how
I
we
agree.
write that lane.
I agree. And in my position today, representing Vermont credit unions, I'm telling you that I'm asking for, us to find fair and balanced, but I agree and I understand. And we certainly will move forward with whatever this committee decides. We want meaningful relief. We recognize, and we don't want to put hurdles that make it impossible to find relief. And so we hear you. You know, one of the things that I thought potentially is some type of a form that indicated a reason why maybe it didn't meet the criteria for course debt that the creditor then needed to return. But we heard Grace share that, you know, in her experience with mortgage relief, that isn't always necessarily helpful as well. So I'm not sure that's meaningful, but I hear your concern. I understand. I can say credit unions wouldn't do that, but I can't speak on behalf of everyone.
Thank you.
Jonathan?
What is the occupation of the person within a credit union who would be doing that work?
The review. Is that what you mean?
Yeah, the person who be making this determination, is that a adjuster? I mean, what's that occupation?
Likely it's someone who works in the compliance department, which is somebody who has a significant level of training and certification annually and would work regularly with law enforcement, often would get called to speak and by subpoena to speak in cases of either victim abuse or elder abuse.
I was wondering if there are guardrails around how those individuals conduct their work that would help us understand what a good faith basis is. It's like they're not going to go through garbage. They're not hounding people on social media. I'm just wondering what that work is like.
Sure.
And like where they're not going to look here or there. That's, I was just saying that maybe help me flesh this out a bit. But
And in credit unions participation, yeah, I believe we can safely say that's not going to happen. But yeah, I understand what you're suggesting, that perhaps we can put some guardrails around it. And certainly, and I made this comment in terms of the transaction holds and hope that we have a chance to discuss that. But we would, as credit unions, we have regular training for all our staff on many regulations that are required through, federal banking laws. And we also would welcome additional training and guidance, whether it be, through the network or through, senior Vermont Counseling on Aging or, agencies to provide some guardrails around what that good faith review looked like.
One more of a curiosity question. So isn't there a mechanism for debt forgiveness just in general? Like say I go and I rack up a credit card for $100,000, I lose my job. Is there a mechanism there? I know it is with some banks where someone can go in and say, hey, I can't pay this debt. And then there's a process that you can go through to get some of that forgiven. And I bring it up because I'm wondering, can we look at how that is done? And can that help us with some of the guidelines on the poor's debt?
There are several different mechanisms. So for example, a borrower could potentially buy a debt protection that if they lost their job, the debt protection would kick in and help to pay off the balance. There's something like that. You may be referring to what we often see advertised on television, where people can work with agencies to help negotiate on their behalf. And traditionally what that is would be when it's sold to a third party, they're agreeing to take a portion of the payment as opposed to the whole. So in lieu of, not collecting anything, a collection agency may say, well, I'll collect a third of your balance. But generically speaking, we just forget it.
I just didn't know.
Yeah. Yeah. I mean, absolutely. Do banks and credit unions charge off losses every single day? Yes. Yes.
Problem with your scenario is that it stays on your credit report for 7 years. So that means you probably won't get a loan. Your credit score is going to tank and you're going to have a hard time for 7 years.
Yes, because even when an agreement is reached, it shows on your credit report differently than if you paid as agreed.
Yeah, so thanks very much for your testimony, because it really helped clarify. I think it got down to the nub of what the issue was. And I appreciate your statement, if I remember correctly, that you wouldn't want to commence action on the debt unless you had proof of fraud and evidence of proof of fraud. So that was very helpful in terms of clarity. And I guess then it's, so how do you show that evidence, right?
Yeah.
And so I hear your concerns. I'm also thinking that the debtor has already laid their situation there, in terms of some of these sensitive kinds of things. Where are we going? It'd be really nice to know, if the creditor is saying, hey, I really think this is something foul going on, and here is why I think so. But I'm hearing you reluctant to saying that, putting in writing that next step.
Well,
Am I right?
Well, I think it would put us in a position that we would potentially expose something in writing that we don't necessarily have permission to expose to a third party.
What do you mean by permission?
Well, for example, if we were to believe that a perpetrator was involved in this claim, we wouldn't want to accuse someone without a judgment of that perpetrator. Right?
You identify, who you're talking about, but you could still, I shouldn't go any further. I could think of things, I could imagine ways to get around that.
Okay. But I think that's my concern, is that I'm afraid that to meaningfully provide evidence back, it would have to be so significantly redacted that it might not be helpful anyway,
Okay, I hear you. Thank you.
in order to protect every party involved. Yeah. That being said, it's not, there are several states that have course debt laws in place that are allowing creditors to recommence collection. Both California and New York allow that in their course debt laws after a review period. They, of course, allow the opportunity for the debtor to go to court if they want to continue to pursue this. But I guess one thing I will leave you with, the way this is being positioned is victims against financial institutions. And I just want to go on record. Credit unions want to find meaningful relief for victims. We absolutely are not trying to suggest that we want to make it any harder than authentic victims to find relief. Our concern is the bad actors who may exploit this bill to their own benefit. And we just want to make sure that we sort of close all the potential loopholes for those bad actors. We are not asking to make it harder for victims to prove that they need relief. We agree they deserve relief.
Yeah, you certainly don't want to tip someone off that is trying to commit fraud. The evidence that you had. Right, and so I'm just thinking of what are the scenarios that would have a financial institution determine that it's not coerced debt. It's either insufficient evidence or they find fraud, they found fraud. And so when it's insufficient, they're just going to kick it back and say, we don't have enough information, you didn't provide enough information, give us more. The other piece is going to be, we're going to call law enforcement and we're going to have this taken a look at. That's, I don't know if there's another scenario.
Say something. Well, could there be a scenario where there's a gray area in terms of maybe it's not enough information? Or, I mean, the statement of coerced debt doesn't include, some kind of a third-party analysis. I have. is, is,
Okay. We're being called to the floor. So I think we have this on. Yeah, for Friday. So we'll invite Chris was to find Senate Finance, he's still there. And we also had someone else that wanted to testify as well. Andrea, we can invite again for Friday. Okay. Let's see if we can narrow things down by Friday. Andrea, thank you. Sorry we couldn't get to you.
Oh, you're closing the hearing?
We have to go to the floor now.
Oh, okay. So please refer to my written testimony. I did submit written testimony.
Great.
And I have a lot to say about what you were talking about today. If anyone wants to reach out to me and connect with me, I'm happy to do that as well.
Okay, thank you very much. We appreciate it. Sorry we couldn't get to you.
All right. Thank you.
Thank you. So committee, we're back on again tomorrow at 9. We're gonna take a look at 650, which is the educational technology products bill, and then we're gonna have more conversations on CTE at 10:30 with AOE.
There'll be a new version of 650 between now and then.
And we'll take a look at H211 tomorrow afternoon. Okay, so with that, we can go off